So why is positioning important? So let's go over this by looking at a few cases. Here's an example, MLO views of a patient. Here's the right side, here's the left side. The nipple is not in profile, and as you draw the line posteriorly, it does not meet the pectoralis musculature, and then the inframammary fold is poorly visualized. On the left breast is a little bit better, nipple is in profile, but as you draw the line posteriorly, it barely meets the pectoralis musculature. Inframammary fold is poorly visualized, and here you barely get a hint of an asymmetry which could have been easily missed, but this was called back for additional imaging, seen on the next slide. So here on the diagnostic evaluation, here's the straight lateral view with more complete evaluation and inclusion of the posterior tissue. Does show the same asymmetry a little bit better, and on the spot compression view the asymmetry persists. Here's the corresponding ultrasound image of the mammographic mass, showing in the very posterior lower left breast this irregular hypoechoic mass that's anti-parallel and is located very posteriorly. These are ribs here, and this is your pectoralis musculature. Here we have the mammogram on the left and corresponding MRI image on the right. The mass that was very posterior, seen on mammogram, which turned out to be malignancy, is better delineated anatomically on the corresponding MRI with posterior musculature going here, and the cancer is very, very posterior. So again, the inclusion of the posterior tissue is very important on the screening mammogram to be able to detect cancers in these locations by the radiologists. So this is a next case, again redemonstrating the importance of inclusion of the posterior tissue, and this was noticed by the radiologist, and subsequent diagnostic evaluation shown on the next slide shows obvious cancer that is much bigger than initially anticipated just on the screening mammogram. Another case here, so these are CC view of the right, CC view of the left. Initially, as you evaluate, you get distracted by the irregular mass with distortion here, but as you look at more posteriorly on the edge of film, there is another spiculated mass there, and the MLO view on the next shows that medial posterior irregular mass is again at the posterior edge of the breast. And again, if you were to evaluate the correct positioning, here's the nipple, and as you draw posterior axis line, it does not meet the pectoralis line, which ends here. So this is an important area to be included on all screening mammograms. Next case is the importance of motion. So when there is too much motion, there is blurring, and blurring causes poor visualization of calcifications. So there is hint of some increased dot density here, but it's not well characterized, and this is likely due to motion, because if you look at the breast parenchyma, the separation between the dark fat and the white parenchyma is poorly delineated with lots of gray. So this shows that there is too much motion. Subsequent evaluation of the same patient demonstrates clear calcifications, not only this location, but more posteriorly in the breast. And this is an inversion of the black and white, again showing the calcifications here and there. And these are poorly seen on the screening mammogram due to motion. I hope the cases illustrate the importance of optimal patient positioning. The edges, lateral, medial, and posterior edges of the breast are very important not to miss posteriorly located cancers. And these also include the inframammary fold and correct positioning of the pectoralis nipple axis line. And especially for calcifications, the motion needs to be limited. Again, thank you for your participation.